I think even small approaches, small steps, like even Obama, whether you support him or not, you know, in the speech he gave to the schools, he had small little things that he was talking about, washing your hands, and everyone made fun of him. You know, it was a joke to people. And these are small little things. It's not changing the system, but these are small little preventative things that really do. I mean, there's signs everywhere when you're growing up.
See, I think those are the things that haven't worked because it's been too fragmented.
Right.
I was talking to Steve about this. Those of us old enough, maybe Jeff's not old enough. But back in the 80s, we remember Ronald Reagan say what he wanted about him, but when he wanted tax cuts, he went up there with his pie charts, much like Ross Perot did 10 years later, and said, this is why we need to do this, because the 70s were a horrible decade, and we need to turn things around here. This is from his perspective, this is my perspective. So what I think has been lacking is that Obama needs to get up there, and he needs to basically get those pie charts and get in the Oval Office, behind his desk, and basically talk about why this is a crisis, and talk about a different model. I think you're exactly right, is that it has to be a crisis model, I think it has to.
Don't you think people are more skeptical and at least they consider themselves more informed now? So maybe having someone better informed, or they consider themselves whether they are.
But I don't think they're quite there yet because, you know, Obama, I thought he gave a great speech when he went there, and that guy from Georgia yelled at him, and one before Congress, yeah, we're but anyway, so it's all the Confederacy. But anyway, so I thought they gave a great speech, but it's every time they do that, it seems to lose momentum after that. And then what happens is you have different voices come out, like Harry Reid is now the leading voice on it. Where last week it was Max Baucus, and I mean it's too fragmented.
Well, I'd like to see someone like yourself or like my oncologist.
What you said is exactly how I think it should be framed. $6,000 a month, we die. That's exactly the kind of model we're talking about here, a life or death model.
We're
talking about. I mean, I think I saw a figure somewhere that it shows how many people actually die because of poor health care. And somebody in Fox News ridiculed whoever said it. I think it was that guy Grayson, who was a bit on the edge, but that guy is Congressman. Yeah. But he called it a Holocaust, I think. But when you think about it, and those numbers do add up to like a Holocaust kind of a figure. So I mean, maybe that's an extreme word to use, but you know, maybe that's how it has to be.
I want to change one of your figures. You know, in my little practice, revenue of about $250,000 a year, $70,000 goes right out the door to malpractice. Now, we're not talking about the claims, which might only represent 2%, but the cost is actually substantial. In a general OBGYN practice, which revenue is between $500 and $1 million, in New York City they're paying $150,000. So between 15 and 30% of their revenue goes out the doors in malpractice.
So that's $700 billion in waste, you know, you already said too. And I think for a sustainable solution, really what has to be known is what's the most cost-effective way to treat each patient. Otherwise, you know, no matter what we do, single payer or any other method, cost is going to continue to rise unless we get the knowledge to know that for this particular patient, this particular situation, this is what will work the best. You know, outcomes for the least cost, and we just don't have that knowledge.
We do have a tremendous amount of knowledge, and you've heard me say this before, that one of the things you also have to do besides tort reform is take physicians out of healthcare as much as possible. You know, make it a algorithm or a treatment plan as much as possible, so that they don't have to make those decisions, shouldn't be making those decisions for the majority of our illnesses. You know, you've got a respiratory tract infection, you got this, no antibiotics, no Tamiflu, go home, chicken soup, okay? And no doctor needs to be involved because then they'll fuck it up and give you antibiotics.
Okay? Right now, you know, the providers are paying for doing more fee for service rather than doing better and more cost effectively. That's primarily.
But this is actually not that difficult. You know, you can make a lot of the stuff over the counter. You know, whether it's contraceptive or other things that we could all think of, that should be done really automatically in the patient's hand. And then, you know, if you want to say there's a role for consumerism, it's in, or even capitalism, it's in these low-tech, low-significant problems where they can do it themselves.
Low-tech solutions for high-tech problems. Oh. But I think one of the things that even said earlier...
High-tech solutions for low-tech problems, no, in America.
Well, but that's what I'm learning when I'm working in a country like Haiti, which, you know, isn't socialized like Italy or isn't, you know, but it's a country that is just broken healthcare system. Mm-hmm. But one of the points that you made earlier to me, I don't remember if it was in this discussion, but was the cap on when a drug can become a generic.